my lifestyle. I'm the new thing with a bright smile. Catch me when I'm out in public, always show them love, and I know they love it. Give you a reason to love me this season. I'm taking my chances, I hope it enhances my...
Welcome to Romera Records Podcast. Today we have on...
William Weller.
How's it going, Will?
It's going well.
Good. So, I have you on because you were my surgeon for my thumb.
Yeah.
And I actually haven't really told anybody about it. So, this was August, I want to say 16th or something like that. My dog attacked me. Do you know like the real story? Did I tell you?
I know kind of the quick snippet version, but I don't know all the details. Yeah.
So it was actually a really weird situation. So I was going to Full Sail University online, just taking classes through music like that. And I was just doing my homework in my room. And my wife comes home. She comes home around, it was like 8 something at night. And then she's just coming in. And I was like, let me go hang out with her and the dog. So I stopped doing my homework. And then I go out there, hang out with them on the couch. And then I'm just like hanging out with RJ and like touching him or whatever. And then I'm like, all right, let me go back to doing my homework. I get up and he just like attacks me, just like runs after me. And it was so weird, but I say it couldn't have happened at a better time because I work Sunday through Thursday. Mm-hmm. And it happened on a Thursday night. It was late Thursday night. And we leave. We go to, I can't think of the name of it. It's in Bartlett, the little hospital there. And then I go there first. I'm there for probably like maybe an hour, 2 hours. And then that's when the ambulance takes me to the other hospital. And then I'm there all night. And then they say, the one doctor that can do this, he's usually not here, but he's here right now. And he said he'll do it in the morning. I'm like, perfect.
Yeah, worked out well.
So, it just so happened to be you. So what was that situation?
So I covered kind of hand call down at Regional One Health, and basically myself and a few of my other partners, if you have a hand injury and you come in and it needs taken care of, we take care of it. For you, the stars just aligned. It was I was there, and we got to get you taken care of quick and early. But we get a lot of. It's not an uncommon scenario. Your type of scenario. I take care of a lot of dog bites. I mean, some really devastating injuries sometimes. But a lot of times we're able to do things and get people back to full function. Yeah. So.
Do you always work at that particular hospital? Or you jump around?
No. So I'm a part of Campbell Clinic Orthopedics, which is based out of Memphis. We've been here pretty much longer than anyone ever. Okay. Willis Campbell was the founding orthopedic surgeon. It was founded in 1909. Really before orthopedics was a subspecialty. He was kind of one of the early subspecialty pioneers. So he founded his clinic, which used to be downtown Memphis. And he was affiliated with what was called the Crippled Children's Hospital at that time. Took care of a lot of kids with, polio, growth deformities, traumatic type stuff. And then with the start of that, he also started an orthopedic residency where you train the next generation of orthopedic surgeons. And so that whole process was in its infancy of how to train our subspecialty doctors. And from that, over 100 years of orthopedic trainees have come out of our clinic. We're now affiliated with University of Tennessee. So we're a big operation that we have subspecialists like me who do hand surgery, and then my other partners, Fred Azar's sports medicine doctor, covers the Grizzlies. Barry Phillips covers Memphis. We have joint surgeons that are great, so they're putting in total joints like Patrick Toy and Jim Guyton. And then we've got oncology guys who are taking care of bone tumors. And then we have a whole wing of therapy and even non-operative physiatrists that can help you, if you have an irritated nerve root, an injection, those type of things. So in that whole kind of company, we also cover ERs and call and stuff like that. So it's just a way to, take care of people and spread our footprint as best we can to people like you in your scenario. You get sent to another hospital where they don't have that subspecialty coverage, then you can get in touch with someone like us.
Yeah, it was.
It's quite an experience, I bet.
Yeah, I was a little upset because when I got to the Bartlett place, I came in there calm, and I was trying to be as calm as possible because my wife is just freaking out.
It's a scary experience. Yeah.
Yeah, like after it happened, she's just like shaking and freaking out. I'm like, calm down, take me to the hospital. Yeah. So she's driving me there, and then we get there, and I'm just like, I just so happen to have a bandana in the car, so I take the bandana. And I picked up my thumb when we left the house. Yeah. And then I put that, I think I put that in the bandana. And then I also just like wrapped my finger up and just was holding it. Yeah. And then I get to the counter. There's some kid who like, I don't know what happened, but he was like holding his eye. I think he got his eye poked out that night. And then, so I'm just like standing at the counter, just like waiting. And then the kid, they get out of the way. And then she's like, hey, what's going on? What happened? I was like, I got my thumb bit off. And then she was like, wait, what? And I was like, my thumb is bit off. And she was like, hold on, show me. And then I was like, she was like, oh my God, come through the door. So I got in there, and they ended up giving me some drugs to like, calm me down, nerves, all that stuff. And I think I'm sitting there for probably 45 minutes, maybe an hour. And they're taking care of me, but then they said the ambulance was like on the way, and I was like, all right, cool. And I think I sat there for probably like 30 minutes to an hour, and they said they were on their way like a long time ago, and I was like, look, if they don't come in like the next 5 minutes, I'm just going to leave and drive myself to the next hospital. And they're like, hold on. So they call, and the guy's like mad, like, how come y'all aren't here and everything? And he said, the guy's going to leave. And I was like, all right, what's going on? And he was like, they said they'll be here within like next 30 minutes. Yeah. I was like, okay. So another hour rolls by, and they finally show up. And I was like, all right, whatever. So that's when we end up leaving and getting to the other hospital.
Yeah. Yeah, the experiences often with transfers and stuff like that are just, it's always hard. Those first responders and whatnot they're being pulled everywhere, and probably 1 second they think they're going one place, and then boom, something more urgent pops up. And I wish I could say sometimes my surgical schedule is all laid out, and then something comes in that just has to be dealt with at that moment, and that pushes things back, and it's just the nature of the field.
So how do you do priority wise?
It's just like any other assessment, that you'd have in hospitals or probably wartime, or just the urgency of things, survivability.
Like life-threatening?
Yeah, life-threatening. So obviously life-threatening is most important, and, Regional 1 Health is the place that if you have a life-threatening traumatic injury, that's what they do excellently. And so you come in and you have a life-threatening, you get fast-track straight to whatever you need. And then below that is limb-threatening, scenarios where people have blood vessel injuries and they need their blood vessels repaired, open fractures or broken bones that need to be washed out so you don't get deep infections, stuff like that. So the various subspecialties just work in concert to figure out, right, what needs to go first, second, third, et cetera, et cetera.
Okay. So, have you ever been dragged like during a surgery? Like they're like, hey, by the way.
No, usually in that scenario, they'd call in another surgeon.
Oh, yeah. Okay.
So luckily, that's usually how that goes. or things are just as you experience. There's always a little bit of a build up in terms of getting people to the point of evaluation or to the hospital.
Yeah.
Sometimes. So, yeah. I mean, it's a complex but well-oiled process for the most part.
Yeah, I mean, we've been doing surgeries for as long as we've been able to as humans. So,
Yeah.
I mean,
Whether you had anesthetic or not back in
yeah.
the day.
I mean, I guess they did like some moonshine or something just to get you drunk. And,
Yeah, they used to use they used to use alcohol, and the skill of a surgeon was judged off of how quick they could do it, and then the courage of the patient. So you had to have both on board, and then early before anesthetics, it was actually medical culture supposedly was, or surgeons in specific took it as an insult that you needed anesthetic because it questioned their speed and skill.
Wow.
And then with the advent of development of things like ether and whatnot, actually dentistry pioneered anesthesia before really what you think of today as surgery.
Okay.
And yeah, a lot of things in medicine come from dentistry first. So orthopedic implants, bony ingrowth in orthopedic implants like joint replacements came from discoveries in dentistry. My father's a dentist, so he reminds me of that.
Okay.
Yeah.
So is that what got you into becoming a doctor, was the fact that your father was a dentist?
Yeah, I'd go on medical mission trips with him, and those were always eye-opening. I worked with him, and then my best friend's dad is an ear, nose, throat surgeon, so I'd work with him, and there were OBs, podiatrists, just general internists, pediatricians. So I got to kind of see all that. And then I loved science when I was in high school, that kind of got me in that direction. I kind of knew pretty well in high school that I thought I wanted to be a doctor. I just didn't know what kind. And then went to college, majored in science or biology and chemistry, and then went to medical school. And then I got into orthopedics because orthopedics is usually it attracts people with a athletic background because it's musculoskeletal based. So you see a lot of sports injuries. I take care of a lot of sports hand injuries. Things like Drew Brees' injury where he tore the main ligament in his thumb. Do things like that, and or torn elbow ligaments, or what a lot of people know as Tommy John's type surgery. Those type of things.
Now, is that the surgery where baseball players get it a lot?
Yep, it's very common in baseball players.
Yeah, I've heard they get it on purpose sometimes so that it like helps.
Yeah.
Their throwing motion?
So hopefully not. That's a little bit of a...
I don't know if that's like the urban myth type thing.
It is a bit of an urban myth, but it's a misunderstanding of the data to think that if you have an injury that you'll repair it and that you'll actually be better.
Oh.
But the real data is that the people who underwent a Tommy John surgery back in Tommy John was a real baseball player who had that reconstruction, and he did return to a higher level of play than he was before.
Oh, okay.
And there's some studies that show that people do return to a high, equal or somewhat higher level of play, and some of the thought behind that is they were potentially chronically injuring that elbow until a point that it failed, so they were underperforming due to the nagging injury, and then you reconstruct them, they rehab appropriately, and then they're able to increase their velocity. And sometimes people will say, well, if it hurts, just reconstruct it, because then I'm going to be better. Not always the case. And no one bats 1,000. There are complications, and so it's not always as cut and dry as I'm just going to just give me my robo arm.
So do you see, speaking of robo arm, have you seen any type of new technology in the medical field that you just foresee that it's going to make leaps and bounds for medical research or medical practice?
Yeah, I mean, so I deal with upper extremity, hand, wrist, elbow stuff, or injuries, and they have these myoelectric prostheses. They're very expensive, but they're not yet at their, perfection, but it's really fascinating, some of the stuff they can do. So if you had a transradial amputation, they can make you a custom-made prosthesis that's a hand with gears and levers in it, and you do surgery and put nerves in certain areas on the remaining forearm muscles, and with where each of those nerves go, it creates a signature based off the muscle EMG, which is like a electrical kind of signal that comes out from that nerve connected to that muscle. So that signature gets made input A, input B, input C, input D. And so the patient can think, flex my wrist, and it fires that muscle. And if you assign input A to closed fist, the prosthetic hand will close their fist. And then let's say you assign input B to open fist. So the patient thinks, you see their muscle ripple a little bit, and then it'll fire that implant. And so, they can pick up a pen, put their hand here, grasp the object, drink, put the object down. It's not as seamless, obviously, as our hands, but I mean, it's significant for someone who doesn't have something like, who has nothing else.
Yeah,
it can be a good helper hand. So that stuff's fascinating, and I'm sure just with time, they'll be able to put, processors in there that can eventually make things more fluid and lifelike. But those are amazing. They have digit prostheses for people who have amputations back here that are driven by the adjacent joints. Those are pretty fascinating. A lot of this stuff comes out of the military with all the war injuries there. So they have crazy stuff, osteo-integrated prostheses where you implant a bone, or you implant a metal kind of connector into the bone. It comes out of the skin, and they can connect their leg prosthesis into it. So it's literally attached to the skeleton.
Wow.
Which gives more feedback, it's more durable. That's like at the pinnacle of, Walter Reed Hospital and the guys coming back from Afghanistan and whatnot. But it's fascinating stuff. And a lot of early technologies come from the military. Robotic surgery came from the military, stuff like that.
Yeah, I actually have stocks in this company. I was just doing some research on companies to buy stocks into, and technology companies were at the top of my list. And there's a company called Rewalk. I think it's Rewalk Robotics. And I looked into them, and the stocks were pretty cheap. But I was like, all right, let me buy a few stocks in them. And then they did a reverse split. So I was like, when I saw it on my phone, I was like, oh, no, what does this mean? Because I didn't even know what that meant at the time. So when I saw it, they ended up giving me, I think I had 20-something shares. And then I ended up getting like 100 and something shares. And like my profit just went way up. And I was like, oh, this was a good reverse split. But their stocks ended up dropping dramatically after that. But right now it's going back up. So I'm getting back to where I was when they first did the split. But what the company does is they make like it's basically like I don't want to say it's a bracket, but I think it's kind of like a like an attachment to legs. It might be for paraplegic people, but it's kind of like an attachment to help people move better and use their legs in a better function. And it was a military contract that they got. And then once I saw that, like their stock started going back up, and I was like, they get that those reps in that practice, so it helps out. Yeah,
that's fascinating. I mean, there are vets that get back to full service with amputated body parts. I can't imagine how much hard work and courage that takes.
Yeah.
But thankfully, we have people like that.
Have you ever thought about going into the military as a doctor?
I did. I thought about it briefly in medical school. I actually was going to go into the military out of high school.
Okay.
So I was raised in the military. My parents were both officers in the Air Force. And my brother's, he's a Army Green Beret currently, and had previously served in the Air Force. So I was going to graduate high school, go into the military, do 4 years, and then go to college afterwards. But I got denied for medical reasons. I have the most mild form of psoriasis, which is just a benign skin condition. But at the time, that was something that disqualified you. So
you should have lied like my friend.
That's what everybody said.
Yeah.
So that's what everybody said, actually. So I tried to get in the Air Force, then I tried to get in the Marines, Army, and they're like, no.
Oh man.
So then I went to college, and it's a blessing in disguise, I guess. I'm very happy to be where I am, but I mean, it would have been that was something I really wanted to do. And then it came back up again when I was in medical school. I thought about joining again, but the same issue kind of arose, and I didn't want to fight that battle or fudge some paperwork. So this is just the path that God chose for me, and it's great now. I get to help in a different way. So I'm fortunate in that manner.
Yeah, I mean, there's like a running, I guess, joke that people use for doctors in the military. They say they couldn't cut it outside. So it's kind of funny, but at the same time, it's like, they might have just came in by choice. Yeah. Like they might have just wanted to be in the military.
No, there's some absolutely superb military docs.
Yeah.
I remember when I was a medical student, I worked with some guys that I was in San Antonio, and they come over from the military orthopedic program and work with the civilian orthopedic program. They were phenomenal. One of our resident physicians he's signed up to do the military thing after his residency.
Oh, okay.
He's a great resident physician, and will be a superb orthopedic surgeon. We've had military guys come through our training program too, and so yeah, we're really everybody loves military guys because they're gung ho and smart guys.
Yeah.
So in my experience, I'd say it's the opposite. There's some of the most committed, hardworking, smart guys out there. Yeah.
Do you think that there's something that's maybe lacking in the medical field? Maybe whether it's education, funding, or personnel. Is there something that is truly lacking that you would like to see advance?
Yeah, everyone, especially as a surgeon, you always want more.
Yeah, of course, yeah.
There's so many places you can go there. Awareness, like for me, in hand, firework hand injuries around the 4th of July. It's crazy.
I've heard that's out just ridiculous how many people get injured during that.
Yeah, it's a real kind of health issue. I'm a member of the American Academy of Orthopedic Surgeons, and then the American Society for Surgery of the Hand, which is the ASSH. The ASSH has kind of a whole thing about firework hand injuries and firework safety, and so obviously awareness about that, and then through the AAOS, which is the American Academy of Orthopedic Surgeons. They have other kind of public awareness programs about ACL tear prevention, which has been shown to be beneficial, especially in female athletes doing proprioceptive training and kind of, you probably have done them like plyo boxes, stuff like that.
You're saying that's more common in females?
Yeah. It's been shown to help them prevent ACL tear in certain studies, or lessen the risk of ACL tear.
Got you.
So things like that. Education, of course, is always key. So having people that can help push that is extremely helpful, because as a surgeon, you only have a finite amount of time that you can spend, and then you need to go see and talk to more people about surgery. But there's still some other nuances that could be, picked up by a counselor and discussed with the patient, kind of to help optimize them as best we can. So at Camel Clinic, for example, joint surgeons, before they do a total joint now, we actually send them to pre-therapy. So they go to therapy before they get their surgery. And that actually educates them, informs them, and really what's called activates them to, after surgery, they're not just sitting there saying, I've been operated on and now I don't know what to do. They actually know the next step. They know the do's, the don'ts, and it's made a big difference in total joint replacement, to the point now, 10, 15 years ago, it was a 3-day hospital stay. Now you can get a total joint the same day. You limp in terrible pain, you walk out feeling great.
Wow.
It's amazing. Education, resources are always hard to come by, especially when you're at centers that, get the brunt of the transfers or just the brunt of the traumatic injuries. You can always use more operating rooms just to help people. But those type of things.
What do you think is the, I guess the big difference? People always say that Canada, as far as like their medical is pretty good for it to be free, and a lot of people are like, well, you get what you pay for. So you want free medical care, you're going to get that free status, where you wait for forever instead. So do you think it's the system is okay, or? Yeah,
so I think you kind of make a good point there. You get what you pay for type of an idea. Every health system has probably things they do really well and other things they don't do so well. In Canada, there's a set number of dollars set aside for a total joint replacement, and once they exhaust that, total joints are shut down for the rest of the year. Cool. So they may run out of it, in July. And
Jesus.
And so 5 more months.
Oh my God!
If someone says, well, we were going to do you, but we're going to have to push it off till next year, which for elective surgery is not always elective. Usually that only means the time period in which you're going to elect to put it at a time that works for the patient and you. But if you have a horribly painful joint that, is you're living with constant pain, which probably affects you emotionally, and then also physically just getting around, which, if you can't move, you gain weight and all the adverse health effects from that. You just gotta do those type of things.
Yeah, I mean, I think America's, we're doing what we can with what we know. I mean, we've only been around, 1700s, so I mean. But the technology, and as far as medical wise, having hospitals, having some sort of emergency service with transportation, like all that stuff, it's kind of hard to just prioritize people. Like, how do you prioritize a human being?
You absolutely can't. And the good thing is those systems, even the individuals who are on the fringes of society, if you come to the hospital, you're going to get taken care of. If you go to X hospital, which has not a lot of resources because they're in a small community, you get transferred to a hospital if deemed necessary to get your issue addressed. With the socialist model, there are pros and cons. I mean, if you're suffering with joint pain and you want a joint in the U.S., you go see a joint surgeon, and if it's indicated, you get a joint.
Yeah.
Other places, not like that. Canada, you're just going to wait a long time.
Yeah.
And somewhere like, for example, Cuba, you're probably not ever getting a total joint.
Oh man.
I mean, I don't know that 100%, but the points you make, advancements in medicine, they usually come out of the U.S. Because the model is built to pioneer.
Yeah.
Just like we do with a lot of other things.
Yeah. I mean, I feel like that is America's staple as far as capitalism wise. Like we let money drive technology and advancement, and that it's helped, it's worked.
Right. And it's all about, the engines of economy are good when they're tinkered with appropriately. They shouldn't be completely unbridled, but you got to find that right mix to innovate and help people and keep people healthy, but not, create some uber wealthy class and that's it. So, it's everything's in moderation. I would obviously choose American healthcare.
Yeah.
But I'm heavily biased.
So is there something that you feel like you maybe wish you knew, like when you first started doing your practice, or is there something that you feel like you just, you can take it now and then continue with, or?
It's called a practice for a reason. You're constantly learning. I think even starting out right after medical school, you just are constantly learning how to talk to patients and really hear what they're saying, because what sometimes we miss as surgeons is we know your pathology, and we know the surgery you can have, and what we deem as a good outcome, but that may not be the exact same thing as what the patient wants.
Yeah.
So you really have to listen to that patient, and you're talking to them about their hand, and their complaint is, I want my hand stronger, and what you're thinking is, okay, I can do this surgery. It may not make them stronger, but it may help with the pain.
Yeah.
And for them, if they go into that surgery thinking, I'm going to get my hand stronger, and I go into that surgery thinking, all right, we're going to eliminate the pain, but the strength may or may not come back. 3 months, fast forward 3 months later, both your expectations were off.
Yeah.
Because it wasn't discussed you didn't come to that consensus on the front end of saying, look, pain is going to help a lot, or this is going to help a lot with pain, but I can't guarantee you the strength recovery. That patient may or may not have made a different decision, or at least would have been more prepared, and expectations would have been set better. So for me, just hearing kind of those nuances and saying, oftentimes I'll ask patients, what do you want out of your hand or wrist or elbow? What if you had to say one thing that you really want to get out of it? And once they tell me that, I can then kind of drill down on, well, here's what surgery or no surgery could offer you, with potential odds.
Yeah. I mean, as a surgeon, you're like a master of a language, and that language is recovery.
Yeah.
And the everyday person is like a child just learning, and they're like just trying to figure out the right words to explain to you what I want.
Yeah.
So it's it's got to be difficult.
Yeah. I mean, I feel on my side of things, my job is to kind of explain your injury to you, offer you options, educate you about it as much as possible, and then help you make an informed decision, as opposed to being really patriarchal and being like, you need this, all right. Because that's for some people that works, but I think that worked yesteryear. But in today's society, people want to know, and people want to they want to, for the most part, be engaged in their care, and if you can get them to be activated and to participate in their care, that's great. Like someone like you had an injury, you got it fixed, and then you pretty much went. You just knew you were gonna get back to it.
Yeah.
And that's a huge part of it. Is someone having their own kind of go-getter attitude.
Yeah, I didn't skip a day at work.
Yeah.
Like that happened as I said, it happened Thursday night, and I was back to work on Sunday, and everything that was suggested to me, I did it.
Yep.
I didn't deviate. A lot of people will get a cast in their arm, like, hey, don't get it wet. They're swimming the next day. So I was just like, let me just do what they tell me to, because they're the experts. So.
Yeah, especially with hand injuries, the sooner you can get back to function, the sooner you can get that finger bumping into things so it doesn't hurt forever, the better.
Yeah.
There's a fascinating paper written in the 1980s of like 130 surgeons who lost digits, including whole thumbs, some multi-digit index fingers and middle fingers.
Wow.
And only 3 of them retired from operating, which is it just tells you that in someone who's highly motivated, almost no matter the injury, they can persevere.
Yeah.
So as long as they understand the rules of the game and what to expect moving forward, like the people who lost a lot of their thumb, instead of when you operate with instruments, you kind of use these 2 fingers. There's another way you can hold the instruments called palming the instruments, which is actually easier to hold the instruments because you don't put them in the rings. And so some of the surgeons said they're actually better at their job.
That's funny.
Because of it. So it's all in the eye of the beholder. The patient's motivation is a huge component as well.
Interesting.
Yeah.
So I know you got to get out of here. It's already been about 45 minutes.
No problem.
Is there anybody that you think of that I could have on that is in your field or something like that, or somebody you would suggest that I would have on?
Yeah, I can. I've got a whole bunch of partners I could ask. They can come to kind of talk about their field if you want.
Yeah, absolutely.
Or I'm trying to think who else. Yeah, I can maybe some buddies in anesthesia or something like that.
Yeah,
that would work.
That'd be great. Yeah, we can. I guess you can just send me an email sometime, and
I'll ask around and see if someone would be interested.
Cool, awesome.
Yeah.
Well, it's been great having you on.
Yeah.
I'm glad you came by, and we have to do it again some other time.
Absolutely.
Have some other people on.
Good.
All right. Well, thank you for everybody tuning in, and see you next time. Hey, everyone. Thank you for tuning in to the podcast. And if you would, hit the subscribe button. The subscribe button allows you to, subscribe to the podcast. And if you give me a like and give me a comment, that would help out as well. Commenting allows you to have a conversation with me, and liking it allows me to know that you actually like it. And if you dislike it, hit the dislike button twice. That's a real help out for me. So, comment, like, subscribe, and let's keep it rolling.